but we're also talking about people's health. So a lot to weigh there. With that, I think I'll turn it over to you, Amy, or maybe Ross. And do you want to talk about the ordinance proposals that could potentially be considered by the health board later this evening after our regular commission session?
Yes, so just to follow up with you, Mayor, there, I did a quick math on Yankton. You know, maybe we're not quite 15,000, but possibly. You know, if that's the case and we're using 30% and 20% of the 30, we're looking at 4,500 people in Yankton contracting COVID-19 and 900 that could need advanced medical care. In visiting with a doctor at Avera Sacred Heart, the comment was, if that happens, we can't handle it. So we, you know, knowing that, I think, and the levity of that, it has brought us to the point where we looked to the state for guidance. We look for the state to help us because we know that, you know, if something happens in our jurisdictions, we as South Dakotans don't mind getting in the car and driving somewhere to go have supper, or, you know, going to maybe the Makefield Corner for a beer or something. We're adjusted to that. So unless it's a statewide opportunity, you know, it makes it more difficult for us to come to that realization. But she did not do that. So as you said, we're here looking at what we can do in the best interests of our citizens, and we're called to do that. So there's been a meeting of the health board called already. You guys will consider, you commissioners will consider at your regular meeting at 7 o'clock, the naming of the health board. Following that naming, should that occur, we will discuss with the health board committee members, who will be, if you approve them, Dr. Mary Milroy, who's on the call with us, myself, and Nathan Johnson, as well as a number of ex officios at the staff level, to talk about certain measures that we think could be necessary, that we may want to recommend to you for the health, general health and welfare of our city. So one of those is going to be a suggestion that we look at closing some of the facilities, businesses that foster large gatherings of people to come and socialize, you know, restaurants, bars, gyms, entertainment facilities, those types of things. The other is a real concern about municipal elections. We have been told that the governor may consider doing something different with municipal election in April, but she'll decide that at the end of March on veto day. Well, we've already started absentee voting, and I find it, you know, I find it quite frankly hypocritical for us to say, you know, we want to limit people, but then everyone come together and vote. And I realize that's hard for folks running to be disrupted in their candidacy, but I also don't really know that we can really say we're having a fair election if people might be uncomfortable coming to a place where there could be a group of people, and would our results be challenged, etc. So those are the things we're going to be talking about. I'm going to let Ross visit a little bit more about some of the parameters of the ordinance that we're going to think through and that we're going to probably present to you in some fashion tomorrow at your special meeting at noon, because as many of you know, the mayor called a special meeting at noon tomorrow because time is of the essence. And then we can talk a little bit more about the election. So Ross, you're up. Ross, we can't hear you. So whatever you're doing, do something different there, man. No, Ross, we can't hear you. Okay, I'm going to give it a whirl. And Ross, when we can hear you, you jump in. So we worked over the course of the last couple days putting together a temporary emergency ordinance for the health board to consider whether or not they make a recommendation to the city commission on. Basically, it's in keeping with what other cities have done. And our goal is to, of course, flatten that spread, flatten that curve of the spread that we hear so much about. And I know you guys are all pro-business and pro-local economy, and in no way is this something that we had hoped that we would ever have to talk about. So I just want to make that clear, and I hope that that comes clear in the media and in the public, that it's with a heavy heart that I have to bring something like this to you. But again, it's for the betterment and health and welfare of the community. So basically, this indicates that we would recommend this ordinance, and if the commission would want to move forward with it, that restaurants, coffee houses, bars, breweries, dance clubs, gentlemen's clubs, cafes, and other similar places of accommodation offering food and beverages for on-site consumption would be temporarily closed for the public. That would also include things like recreational facilities, pools, health clubs, fitness clubs, social clubs, fraternal organizations where groups of folks meet together, athletic and training facilities, movie theaters, production theaters, those types of things. Things like tobacco shops and lounges, vaping shops, hookah lounges, those types of things, pool halls, gaming arcades, video lottery, bowling alleys, skating rinks, all those kinds of facilities would be places that this ordinance would temporarily close due to their nature of encouraging, close connectivity. Now, the exception would be if said restaurant offers a carry-out or take-out option. We're working with the governor's recommendations to try to do our very best to let people be innovative. So, if you run, El Tapatio and you can do delivery, or you can do takeaway or carry away and operate your business in that sort of way, that would be an exception to that type of ordinance. So that would be available should the business owner want to participate that way. We also have some exceptions for things like room service in hotels, things where you're not getting together and having a buffet breakfast together, but you're ordering in, it's taken to your room, etc. So those types of things would be also an exception. The timeline for this ordinance is interesting. So to be just fair and open with the public, the attorneys for municipalities across the state have visited together a lot, as have city managers, about how do we do this? How do we enact an emergency ordinance in a short order? Can we do it? Do we need, to do the regular hearings and wait the days and 20 days after publication? I mean, if we wait 20 days after a publication, it's too late here, right? So Ross has researched that extensively, and he feels the soonest that this could be done would be a recommendation tonight from the health board, would come to you tomorrow in your special meeting, and you could then effectively consider that ordinance without a traditional first reading, and then move forward with that for a second reading. You could set the date that it would go into effect, and we've suggested that it would be in effect as early as this Thursday, and that's the 26th of March. Now, your second reading, the earliest you could hold your second reading is March the 30th. And so we have to then publish, that's next Monday, we have to publish. I know that the P&D would help us get that published as soon as possible, and it could be effective upon publication. So technically it would be legally effective and enforceable to the extent we can enforce it on the 31st, as soon as we can get it published in our paper. But we would like to recommend that it's in practice at least as early as this Thursday. Many of you have asked about enforcement and what that looks like. So what that looks like is being talked about, but here's what we think. We have changed our operations in our police department. Many of you know that. We do have some people out already in our PD. And so we are, changing the way we do operations. In visiting with Commander Foote, what this would probably look like is first a call to the business saying, hey, looks like you're open. Looks like Amy Miner's Bar and Grill is open and they're having a luau, and we have this ordinance in place now. Did you know about this ordinance? So the first step would be an educational process. Here's a copy of the ordinance. We'd ask the owner or manager to come out. Our officers would talk with them. Okay, give them some time to make that compliance and excuse people and get shut down or get closed or get their folks out of there safely. And if they don't do that, follow that up with a progressive step of enforcement, not sending people in or anything like that, but another order, for lack of a better word. And if they fail to comply, then a decision the following day as to whether or not, in discussion with our city attorney, they would actually be cited, because under this ordinance, it would technically be illegal and be a crime to be open. So it would be a misdemeanor crime, I believe. But still impactful. So that's how the ordinance is set up right now. Again, we haven't had as much time as we'd like to discuss those parameters and all the language. We are going to talk about that later on. But I wanted to use this time to introduce that to you, talk to you about that, and I'm sure there's questions and things that you have that we can help answer. And so I would, as you guys are asking questions, I'm going to look to Ross for a thumbs up or thumbs down on how I did, since he left me. Okay, great. I'm also an attorney in my spare time, so if you have questions, let's hear them. I'll do my best to answer them. I don't know, Ross's miming something, but I'll get through it.
Can you guys hear me? Hello? You can hear that?
Yes, we can. After I did all the
all right. Yeah, good job, Amy.
If you, questions for Ross are really your guys' feedback. This is this is tough. I had one local business owner talk to me already, local bar owner, and not easy for them to digest, nor you, I'm sure.
I have a question people are asking me, and I don't know if we know the answer, but maybe it's an answer we could get prior to our meeting tomorrow. Do we know how many tests we've done in Yankton? Do all of our tests from Yankton go to the state lab in here? Do we have any idea of numbers?
I don't have that information. Mayor, do you happen to from Avera?
I do know that the drive-through sample collection center on the north side of town, as of this morning, they had collected 95 samples. That wouldn't necessarily be everything, probably. Well, it wouldn't be, because there's inpatients in the hospital. Also, Nebraska residents, if they get tested here, those samples, or if their samples are collected in Yankton, they are sent back to Nebraska for testing. So, yeah.
Second part of that question, do we have enough tests? Are we able to test the people that need to be tested?
I would say, and I'm answering this just because I live in this world, the healthcare world, and I've been paying attention to this from a statewide perspective, is the state last week halted tests on Monday because it ran out of the reagent needed to process them. They resumed on Thursday, but I think through the weekend they only did 100 or so. So, as of today, there were 265 pending tests in the state lab. I know of one person who had a sample collected Sunday of last week, still has not gotten results. Hopefully that situation is going to change as Avera and I think probably Sanford have other private options available, and they will start even doing their own tests in-house very soon.
I think Dr. Milroy has a comment too on that.
Yeah, I was actually going to address that in the fact that you can take 1 million swabs if you want, but if you don't process them, they don't help you at all. We could test everybody in town and go put it on a shelf, but we're not getting results back. And I know someone who had a test on Sunday who tried today many times to call and see if it was possible to track down that result. It wasn't. When he was trying to track it down, they even mentioned that there's an inpatient in the hospital right now, today, that they can't get a result on. 8 days out. 8 days out. No result. So I think that we have a real problem with getting results. And the problem with some of that is that in order to contain an epidemic, you really need to know who are the affected people so you can quarantine them. We're not in that situation right now at all. We do not know how many people are out there. The question that came to my mind that I have not heard on the news or anywhere from the lab is, how accurate are those samples once they've sat around for 8 days? When I tried to look online about this, if you haven't processed them in about 48 hours, they need to be frozen. But the quality of that specimen starts to go down. So we get a specimen a week ago Monday. How good really is it? I don't know. I mean, I certainly am not a coronavirus expert, but I don't think viruses last indefinitely. So I just have real concerns about how the testing's going. We may not have any idea what our problem is.
Thank you. I would just follow up with that, saying that that's my understanding and my feeling as well, and people are expressing it to me, that we really are taking a big guess at these numbers. This 30% that we've come up with is based on really limited testing, and that we're probably looking at something that's much more extensive. So I just want to put that out there, that people are keeping that in mind when we look at the numbers. They're probably likely very underreported.
Yeah, I'll say something. The other thing that I think is a big concern with this too is the number of asymptomatic carriers that are out there too. And I think that speaks to the distancing and closing gatherings in a very real way, because we can't test the symptomatic people, but goodness sakes, we have no idea who's out in the community who's asymptomatic, spreading to very vulnerable people.
So Dr. Milroy or Nathan, are you saying then that some of these negative tests maybe could be positive just because of the waiting around so long? Or I guess could we potentially be seeing false negatives? And then my second comment, I know the mortality rate is lower on this, but there's still a mortality rate. And using simple math, even if it's 1%, which doesn't seem like a lot, we're talking 45 people just in Yankton, using your simple math that you used earlier. That's pretty scary.
I don't think any test known to medicine is 100%. I think that what happens is when you have a test and it is maybe imperfectly processed, your risk of negatives, false negatives, goes up really drastically and dramatically. And I think I've heard numbers in terms of mortality rates much higher than 1%. So, but I think we don't know. We're not counting the asymptomatic, so we actually don't know. So, but you're right. It could be 1%. It could be 2%. What if it was 90 people in Yankton who died? I mean, we'd be facing a catastrophe the likes of which we've never seen before. So,
we really, I think we've all been looking and, like I said, doing the math and trying to figure out. And none of us, maybe with the exception of the doctors, are probably qualified to do all this type of, data crunching and we probably don't really understand what is out there. So focusing on what we can do in our power, because if you've been around, you've seen that people haven't really taken heed to the social distancing. They haven't taken heed to the, don't get in groups. I was really sad to see groups of young people who are off school gathering together. I mean, that's dangerous for everybody, the whole community. So, it's impossible to know what's coming, and we can't probably totally stop what's coming. But if we can slow this down to make it more manageable, that might make the difference between one of those people that would have been in that percentile of mortality or getting gravely ill, doing a little better because they have a hospital bed or they have a ventilator, that type of thing. So I think that's where this is coming from. Prevention is probably not happening at this point, but I think being able to do what we can within our authority or your authority, doing what you can within your authority to help our health system is probably the best we can do.
Yeah, I think we've hit on a very important point here in that there just hasn't been enough testing in our state to have any idea how large of a problem we're dealing with. And then the scary thing is we've seen in other countries, even in other states, how quickly this explodes into something unmanageable. So in South Dakota, I think we've had the benefit of more time to prepare. So it's incumbent upon us to make wise decisions having more time. However, it shouldn't be encouragement for us to just take our time and wait and see what happens. So that's why I feel a sense of urgency around this.
I'll say this again. I've been getting texts and emails and a phone call. It seems that two things are unavoidable with this. One is massive economic disruption. And the other, of course, is some sort of a human toll. And I'm hearing repeatedly that as much as we hate what this is going to do to businesses, we have to take the steps that we need and rely on our state and national leaders to help provide a helping hand, because it's not just us, it is absolutely nationwide. Everybody's in trouble. I feel like the one thing that we can do as commissioners is take some steps to reduce the human toll. I don't know that we have a lot of economic tools at our disposal right now to make an immediate difference right here in town. But I know with some of these, so beyond social distancing, saying people please don't gather, that can make an immediate impact on the health and well-being of our citizens. And I'm hearing people say that's most valuable right at this moment.
Well, along that line, Amy, I've heard from, I would say, at least 3 business owners who would be impacted, like restaurants or fitness centers, who have asked that we shut them down. They think it's the right thing to do. I just got an email from the board chair of the Yankton Medical Clinic, who said that they encourage us, or they will support us in taking measures to limit social gatherings in our city along the lines of what we're discussing here tonight. As medical professionals, they think that is what is needed.
Amy or Ross, you want to, what we haven't discussed in this ordinance is the second part of this ordinance. Do you want to go over that a little bit and explain why that's in here?
Ross, are you available to talk? I think that's better left for Ross to talk about. Somebody else have a comment while Ross is?
Yes, I do. Jake here. Yeah, it's a lot to talk about, a lot to discuss, and many tough decisions. As far as the businesses, Mayor Johnson alluded to the fact that some businesses want us to shut them down. Well, they have that opportunity. They can just close their doors. Or they're asking us to close their competition down so they feel better. It's a tough one. And then you tell yourself, well, we'll just close bars. Well, what about the restaurants that have bars in them? It's really hard. And I think that obviously we don't have the answers, but we will soon, hopefully, as far as the trends and everything else. So as for now, I think we'll go through our meetings and try to figure out what the best solution is. And by that time, hopefully we'll have more valuable and positive information.
Can you guys hear me now? Yes. Okay, good.
Just while I'm sitting right now, I just got a text that came this minute, and it just says, this is from a hair salon owner who just texted me like 1 minute ago. Hey, why on earth hasn't someone shut the salons down yet? I've called the cosmetology board in Pierre. They say the governor can do that. Now the governor says she can't. When in doubt, do I stay home? Do I close? That's a business owner that's kind of wondering, why isn't anybody doing anything? I know that there actually already now are 12 states that have enacted statewide stay-in-place orders. And so, I think right now it seems like we're not getting a lot of guidance from the governor's office. And I just think for the health of our community, the well-being, the public health, that's something somebody's got to act. And I think it really is us. So.
Dr. Milroy, I think you bring up another good point in that every state around us has already shut down bars, restaurants, and many of these other businesses where people gather, like salons, for example, or have close, personal contact like that. Nebraska has not, but they have done it on a limited basis, I believe, in 4 counties around the Omaha area where they've had some community spread. So to think that we're somehow getting ahead of the curve on this, I think would be I think that's a misleading thought. We are actually perhaps behind the curve if we're comparing ourselves to everyone around us.
You guys ready for me to take you through the limitations?
Yeah.
The second part of this?
I'm sorry, Ross,
Yep.
Can I make one comment? Related to what Dr. Milroy and Jake and Nathan have just said, this is new territory, and I was just interacting with business on Saturday, and they were asking, what do we do? What are other states doing? There is a hunger for leadership. people are looking to leaders to say, this is what we need to do. And there's a lot of mixed messaging happening at the federal level. There's some mixed messaging happening at the state level. And I feel like we are left as a municipality to make a decision that's right for Yankton. And I don't think we can look to anyone. I think we have to look to ourselves and listen to our constituents. Because I think we're it. I think we have to step up and lead.
Okay. To that end, then, the ordinance that's been drafted as of now, in addition to closing social gathering locations, I have drafted in 2 separate regulations that are not necessarily effective immediately unless the commission wants it to be. But by resolution, you could add some additional prohibitions. The first is limitation of gathering sizes. The ability to pass a resolution that says in the city of Yankton, we cannot have gatherings of more than more than 10, 15, 25 people, whatever you guys think is the appropriate size. But that could be a regulation that you pass just by simple resolution. So we could do it in a hurry if we needed to, as quickly as essentially an agenda published 24 hours before a special meeting to get that passed. The second level of this is the ability to implement a closure of all non-essential businesses that might be beyond the scope of social gathering locations. Those are not directly prohibited by this initial round, this initial ordinance passage, but gives the commission the legislative authority to close non-essential businesses again by resolution. Does that make sense?
And again, the reasoning for that, Ross, is to speed the process up in case it came to that point?
Correct. Yep, that's right. In fact, the regulation as currently drafted is limited in the time frame. The initial closures that are being implemented only last until the Tuesday after our next regularly scheduled meeting in April, leaving open the possibility for the commission to extend that closing with a simple resolution at that first meeting. So the only real regulation we would be imposing, the way it's drafted right now, is to close the social gathering locations until the 14th of April. And this group would have all of the authority that it should need to extend those regulations to account for what's happening in and around Yankton.
I have a question for you, Ross. You said we could limit to 10 or 15 or 25. Are the CDC guidelines currently 10 or below?
As of the last few days, everything I seem to hear is now 10.
I would recommend that we would follow the CDC guidelines and not exceed 10 then.
Yeah, and given the governor's guidance that came out today, the governor recommended no gatherings greater than 10. So I think in light of that guidance, it makes sense to just proactively limit gatherings of more than 10 people, rather than starting with a slate that gives you the authority to do it later. I would just start with that, but that would be up to this group.
So are you thinking that you're going to talk both resolutions tonight in your first health board meeting and decide which one, or are you saying we'll move forward with the one after discussion and the second one's just kind of in our back pocket if needed?
The idea is we would move forward with the one and the other two would be in our back pocket, but what I'm suggesting to you now is we just revise it initially and just say that it's rather than giving you the authority to impose a 10 people gathering limitation later, we just do it now, giving you the authority to extend it and further reduce the size if necessary by resolution later.
I would add that I wouldn't want to say we're not going to consider the second version at the health board meeting, because I would want to hear Dr. Milroy's input on that. So in my mind, we will have an open discussion during the health board meeting and make a recommendation based on what we think is in the public interest the interest of public health.
And commissioners, we are YouTubing that meeting. So it's not like a commission meeting where it's a public meeting and you guys aren't going to be all on the link because you know, we don't want to create a quorum, but you can listen in and watch that. It's going to be right after our regular commission meeting. Yeah, I think, you know, for me as a voting member of that health board, and I hate to throw this on Dr. Milroy, but I'm going to throw a lot on Dr. Milroy because she's, you know, she's a well-respected physician and she has this is a health issue. So I'm going to look to her a lot. I'm also going to lean on the ex officios who have a lot of information about general public health and enforcement and those types of things. And so I'm a little bit unsure what I want to consider right now.
And
we'll have the special meeting to talk about anything that we recommend to you guys as well.
Okay, and then I would encourage too, because a couple of texts and questions I've got is I kind of feel like we may be talking about two different things here. One is closure of those businesses, but then on the other hand, we're saying, well, but less than 10. So I guess my clarification there, and I think what really needs to come out is like one of the texts I got today is, well, what if I have a private birthday party and it's just the 8 of those individuals, you know, I'm closed to the rest of the public, but can I still honor some private parties if it's just them and I'm not open to the public? Because you know, like I'm saying, we're either closing them or are we saying less than 10? And then, you know, which is it? I don't know if it can be both. So I would ask for clarification on that as well.
It's a good question, Ross.
Yeah, my thought on it is you have to look at them as 2 separate regulations. If you violate one but not the other, that doesn't make the first one okay. So I would view it as those businesses that are closed are closed. In all other occasions, you can't gather in groups of 10 or more. Or you can't more than 10 or whatever limit is the recommendation of the board. So if it is a business that has an 8-person birthday party that they want to try to support, and that business is encompassed by the regulation that prohibits that type of business, I would say it would still be a violation for that business to engage in that smaller group gathering. I understand that might seem harsh, but not just group size that we're trying to regulate here. We're trying to keep people apart.
I do see we are approaching 7 o'clock. Is Paul Schurslick on with us this evening?
Yes, he is.
Paul, do you have anything to add?
Yeah, Paul, maybe you could update the commission on the work that's been going on with the task force and any other updates you want to provide.
Sure. We've been meeting Monday through Friday over the noon hour for about an hour. We've got a great selection of folks, the hospitals, the city governments, some elected officials talking about what's going on, where we're at, what needs to be done. I've been listening to you talking about, you know, the numbers, and we're looking at, you know, right now we're looking at doing an MOU to find a place that if we had to put up more people in the event the hospitals, you know, were overrun, you know, we don't have a place for it. We're also possibly looking for doing MOUs for the indigent population or the homeless in the event there isn't a place for them. Unfortunately, we talked about the mortality rate. You know, we're looking at places that what happens if we do get more than what we can handle. We do have, or the state has the big DMORT equipment or like mass fatalities, but that's the like airplane crashes and stuff like that. If we start seeing that there, we're going to have to find our own place. So we're working on places and talking with different partners to make that happen. But all honestly, the core group that we got going on, or all the people that are working really hard. We're doing our social distancing, trying to make it all work. So far, we're doing the Go meeting as we're doing here tonight. It seems to be working real well. I have to say, it's really great to have such a great core group and a bunch of people that are willing to, do almost anything to get this done. The only thing I have to say, and is a concern that I have as the emergency manager for the county, as I totally understand what you guys are doing tonight. One of the concerns that I have, and I know I wish we would get the governor to do more, guidance on this, but is that if you do what you're doing in the city limits, everybody's leaving and going to go out to the lake area or go to other communities in the county because of the drinking and the bars and the stuff like that. But then they all come back to your community. So we maybe need to reach out to more of the smaller towns that have the bars, out to the businesses. I'm going to be speaking to the county commissioners on this matter more as time goes on. But that would be one thing that, I know I don't want you guys to not do something, but that's something that I want you to consider, or that's what I'm worried about, is that we could see maybe something going the wrong way based on pushing them all out of town, and then they're all going to come back. But I think he talks a little bit about that. But other than that, I think it's really awesome what everybody's doing, working together, and I don't know if anybody has any questions for me.
Are there any questions for Paul?
Not a question, but maybe an appropriate time for this. I found a quote today, and it kind of relates back to everything we're talking about. And it says, incredible change happens in your life when you decide to take control of what you do have the power over instead of craving control over what you don't. And I just thought when I saw that today, I'm like, wow, we're going to be having discussions on what we can maybe try to control to do our part to help our community. We can't control what's going on at the state labs and things like that. But I think, as Commissioner Miner said too, we might be the leadership that's being craved in our community right now. So I appreciate those, eventually Dr. Milroy and others who are having these conversations and willing to step up and give us direction. So thank you.
Just to go back to Paul's comments, and for those who are watching and may not know, Paul's the 18th County Emergency Management Director. I do echo that the group has gotten along terrifically, that there has been no turf wars that I've seen. We are all just working together to make sure we're as ready as possible. On the note of other communities in our county, or even the Yankton County Commission, perhaps thinking about what actions they should take, I think we'd be happy to share with them our ordinance. Or if we pass an ordinance, we'd be happy to share that with them. And I think our staff would be willing to visit with them, because we know these smaller communities especially have very limited staff. And so we would want to be a resource for them if we can be. With that, it is 2 minutes.
We have to.
Yep, I think you're thinking the same thing I am, Amy. It's 2 minutes to 7, so I would ask for a motion to adjourn this meeting and go into our regular session.
So moved.
Second.
Al, did you get who made the motion in the second?
I did not get either one. I
Sorry,
apologize.
Al, Mason made the motion.
Excuse me?
Mason Schramm made the motion.
Bridget Benson made the second.
Okay, so we have a motion and a second. Al, can you do roll call?
So to review, Shram moved that the motion, or that the meeting be adjourned. I apologize. Commissioner Benson seconded. Fertig.
Aye.
Fertig votes aye. Hoffner?
Aye.
Commissioner Hoffner votes aye. Miner?
Aye.
Commissioner Miner votes aye. Moser?
Aye.
Commissioner Moser votes aye. Schramm?
Aye.
Commissioner Schramm votes aye. Weber?
Aye.
Commissioner Weber votes aye. Benson?
Aye.
Commissioner Benson votes aye. Sarda?
Sarda, aye.
Commissioner Sarda votes aye. And lastly, Mayor Johnson.
Mayor Johnson votes aye. This meeting is adjourned. Everyone, if you need to take a quick bathroom break, we'll give you some grace on that, but otherwise, see you soon.
Just log out and log on to the next link. If you don't have it, text me immediately and I'll get it to you.